Welcome. Today we're diving into a common, yet often misunderstood, heart condition: heart failure with preserved ejection fraction, or HFpEF. Unlike other types of heart failure where the heart muscle is weakened, in HFpEF, the heart muscle squeezes normally but struggles to relax and fill properly. Let's unravel the complexities of this condition. What causes HFpEF? It's rarely a single cause, but rather a complex interplay of factors. High blood pressure is a major contributor, as it forces the heart to work harder over time, leading to stiffening of the heart muscle. Other significant factors include diabetes, obesity, chronic kidney disease, and even sleep apnea. Think of these conditions as slowly remodeling the heart structure, making it less flexible. To understand HFpEF, it's crucial to grasp the pathophysiology. The primary issue isn't the heart's ability to pump blood out, but its ability to fill with blood properly. The stiff, thickened heart muscle doesn't relax easily during diastole, the filling phase. This leads to increased pressure within the heart chambers, which then backs up into the lungs and the rest of the body. This elevated pressure causes fluid to leak into the lungs, leading to shortness of breath and other symptoms. Inflammation and changes in the lining of blood vessels in the heart also contribute to the problem. HFpEF is a significant public health concern. It accounts for approximately half of all heart failure cases, and its prevalence is increasing, especially in older adults, women, and individuals with the risk factors we've discussed, such as hypertension, diabetes, and obesity. With an aging population and increasing rates of these comorbidities, HFpEF is becoming an even more pressing issue. The signs and symptoms of HFpEF are similar to other types of heart failure, but sometimes more subtle. The most common symptom is shortness of breath, especially during exertion or when lying down. You might also experience fatigue, swelling in the ankles, legs, or abdomen, edema, persistent coughing or wheezing, rapid or irregular heartbeat, and sudden weight gain from fluid retention. If you have these symptoms, it's essential to seek medical attention. Diagnosing HFpEF can be challenging because the ejection fraction, the percentage of blood pumped out of the heart with each beat, is normal or near normal. Diagnosis involves a combination of factors: a thorough medical history and physical examination, blood tests including a BNP or NT-proBNP to measure heart failure markers, an echocardiogram, ultrasound of the heart to assess heart structure and function, and potentially other tests such as a stress test, cardiac MRI, or even cardiac catheterization to rule out other conditions and measure pressures within the heart. While HFpEF isn't typically divided into distinct subtypes in the same way as some other cardiac conditions, understanding the underlying causes is key to tailored treatment. For instance, patients with HFpEF due primarily to hypertension may benefit most from aggressive blood pressure control. Similarly, those with HFpEF linked to obesity may see significant improvement with weight loss. Currently, there's no single cure for HFpEF, so treatment focuses on managing symptoms and improving quality of life. Medications play a critical role. Diuretics help to reduce fluid retention, lowering blood pressure and relieving shortness of breath and swelling. ACE inhibitors, ARBs, or ARN medications, while not as clearly beneficial as in heart failure with reduced ejection fraction, may still be used to manage blood pressure and improve heart function. Beta blockers may be prescribed to control heart rate and blood pressure. SGLT2 inhibitors have shown promise in improving outcomes in HFpEF. Lifestyle modifications are also crucial. These include a low-sodium diet, regular exercise as tolerated, weight management, and smoking cessation. Preventing HFpEF involves addressing the underlying risk factors, managing high blood pressure, controlling diabetes, maintaining a healthy weight, getting regular physical activity, eating a heart-healthy diet, and avoiding smoking are all vital steps. Early detection and management of these risk factors can significantly reduce your risk of developing HFpEF. The prognosis for HFpEF can vary widely depending on the severity of the condition, the presence of other health problems, and how well the condition is managed. While HFpEF can significantly impact quality of life and lifespan, ongoing research offers hope. Recent advances are focusing on understanding the complex mechanisms of HFpEF at a molecular level, leading to the development of new targeted therapies. Clinical trials are exploring novel medications and interventions to improve heart function, reduce symptoms, and ultimately improve outcomes for people living with HFpEF. These are exciting times in HFpEF research, and we are hopeful for continued progress in the future.